My sister was beautiful. My sister was kind. She was gentle. She was smart. She was everything that I looked up to. And because of her giving nature, it was so easy to miss the signs of her struggles.
Participants listened to Maria Remy with rapt attention as she took everyone down memory lane about the joyous moments with her sister, Fabiola Philip, and the sad narrative of Fabiola's mental health struggles that went unnoticed.
In 2017, I lost my mother.
Fabiola's daughter, Lydia Philip, and other members of the community shared stories about living with mental health disorders within the Black community and the need to promote an environment with healthy work-life balance.
In the beginning of my senior year, I woke up one day and I no longer had the will to live. I thought to myself, why would I stay here if I have no one who wants to listen to me? My mother's not here. My family told me, suck it up. You've made a name for yourself, and getting the help you would need would ruin your reputation. By sharing my story, I was able to help other people and help myself. It was last year that a young Black girl came up to me and said, thank you. And I said, for what? She said, thank you for being against the odds. By being in a powerful position and sharing your story shows that you are strong and that having mental illness is not a weakness. And
living and working in the Elliott Lake area, like a house of cards, everything came crashing down. I'm not sure exactly when it all began, but I remember feeling like I was all alone in the world for many months. Even when I was surrounded by people, I had this deep sense of no one in the world cared for me, and I didn't have the strength to continue to care about anything or fully care for anyone, including my children. Every morning, I would struggle to get dressed for work, get into my blue Windstar, wipe my eyes, perform my duties at work, cry my way back home, wipe my eyes again, and muster up some courage before entering the house. Everything was moving too fast, and I just couldn't keep up.
Sharing the space, allowing for community practices, internal practices and strengths and approaches to be included in the healing and support services is critical. We cannot just bring a concept that the community has never used and expect great results. So it's very important that we are able to also meet the community where it's at. Believe it or not, people have been coping with this on their own for a long time, and using those strengths is critical. Understanding that there are strengths within the community is very important.
Academics in the city acknowledged the Black Mental Health Day as a call to action to keep the conversation alive while focusing on changing lives, suicide prevention and substance use.
Today is important because it gives us a platform for bringing together our knowledge and experiences and to bring attention to the scale of the problem. We need more research, we need more dialogues, we need strong platforms to bring attention to the scale of the problem, and we need champions. And so what Councillor King, Somerset West, and the Association of Afro-Caribbean residents of Ottawa have done today is really quite remarkable.
We can all relate to the stories that we've just heard today. The stories about individual family members being addicted to drugs because the actual root causes of the problem of mental health is not addressed. And so we must confront this issue up front. We must continue to engage our family members. We must continue to mobilize the resources that are available in Ottawa to develop targeted programming for Black people in Ottawa so that this discussion can continue. And for me as a researcher, we must collect the evidence. We need resources to collect the data that is necessary to be able to actually show the magnitude of this problem.
I must also say that this was initiated in Toronto, And we're fortunate that Toronto, with the volume, the population of Black residents that they have been able to really create a movement that's gone beyond the city that helps to heighten the urgency around this and helps to elevate the cause.
I'm someone that worked in the HIV field with the City of Ottawa for many years, and we see back and forth people dealing with mental health, and we don't know what this means. We don't know. We don't have enough resource to deal with that. We also, as a worker, we don't have the capacity to deal with that. Yet today, there is a day that has been allocated for mental health in the Black community. Then what? That day has to be followed with resource that we can help our community to deal with that.
The essence of the day is to focus on the need to project culturally responsive mental health support to encourage interactions and treatment in the Black community.